Say you have a sickle cell trait, we mean in your blueprint you have a bit of the sickle cells.
Okay.
So you can either have sickle cell anemia or you have you're a carrier of sickle cell.
Yes.
So if you're a carrier of sickle cell, you cannot manifest with the symptoms of sickle cell disease or sickle cell anemia, but you manifest as you can transfer to someone. Is that clear? In other words, if you have not tested, you cannot know that in your genetics or in your blood you have sickle cell, because you don't usually manifest with symptoms.
Okay.
You understand?
Yes.
Yes, that's why sometimes we get children or people with signs and symptoms of sickle cell and they're like, this looks like sickle cell. And very often they say it cannot be in our bloodline. It can never happen. I remember way back so many years ago, I had an uncle who lost a son. And this child was 12 years and just died. You know, pneumonia.
All of a sudden.
Like, I asked my late dad and I'm like, no, children don't just die of pneumonia at 12 years. What is the problem? There must be something underlying. And that's when I was told he had sickle cell. And I'm like, you mean we have a trait? A bit, and so that pushed me to go and test and find out how am I doing. And thank God I was, I was safe. So very many people are triggered by finding someone with the symptoms that they go and find out that they actually have that trait.
Yes.
You get it?
I do.
Yes. So we have people who are carriers. That means, so you're asking the question, how is it transferred? How does someone get sickle cell? So that means for you to have sickle cell disease, usually both parents either carriers or one of them is a sickler and another one is a carrier. So both parents have a contribution to make for someone to manifest with signs and symptoms of sickle cell disease. Or if one parent is a carrier and another one is normal, some children may be normal and some may be carriers of sickle cell disease.
Wow.
However, if both parents are carrier, it does not mean that all children will be sicklers. You can be lucky and all your children turn out to be normal, though it is very rare. The biggest, you have 50% chance that children will turn out to be carriers. And then you have a certain portion of your children, 25%, to become a sickler. But that doesn't mean to the total population of children you're going to have to that particular pregnancy. So for that particular pregnancy, the chances of a child turning out to be a sickler is 25%, 50% carrier, and 25% normal. So if you're lucky and God blesses you, two carriers can marry each other and the children turn out to be normal.
Wow.
So it is very rare to find.
You're really enlightened. I've seen nowadays churches, they request for tests of sickle cells.
Yes.
So that means you can actually go and test and know whether you're a carrier or you're a sickler.
Yes.
Wow. So in brief, how is it diagnosed?
So sickle cell can be diagnosed clinically, but it's very important to confirm it through tests.
Not through eyes.
So there are signs and symptoms that we see and we suspect that this could be sickle cell disease, okay? But there are so many things that look alike. So in other words, I cannot look at the signs and symptoms and say that is sickle cell disease. What if it is not there?
True.
Things that can look like sickle cell disease. So there are signs and symptoms, for example, that make us suspicious.
Okay.
For example, if a child has recurrent body pains,
recurrent
anemia, they tend to have different pains, unexplainable pains in the body because of maybe the certain spot on the body, blood vessel being blocked, so oxygen and blood is not reaching there, so it tends to be painful, especially in the bones, in the long bones, for example, the legs, the thighs, around the knee, the hips, sometimes they even get chest pain, So if a child gets recurrent unexplainable chest pain, we usually say the commonest cause of unexplainable pain, body pain to a child is sickle cell until proven otherwise. If a child gets recurrent anemia, they tend to get recurrent transfusion. First of all, if a child is well fed, if someone feeds very well and is not bleeding, where is the blood going? So that means there is something eating up this blood. So if you tend to get those episodes of recurrent transfusions,
you run to the doctor.
Then we begin thinking of where is your blood going?
Okay.
Yes. Eyes turning yellow. Yes, because remember I told you their red blood cells lifespan is shorter, almost half of the normal lifespan, or sometimes even a third. So they easily break down the red blood cells, and their liver cannot easily take up. You know, when you break down the red blood cell, you get a yellow pigment called bilirubin.
Yes, yes.
So that is supposed to be taken out of the body by the liver. So because of the high rate of destruction, their liver cannot contain removing the byproduct. So they usually have excess of this bilirubin. So that means they have to have the yellow eyes because the liver cannot contain the amount of destruction. Yes. So those are some of the common signs we see.
So a disclaimer, doctor, sorry to cut you short. Not everyone who has yellow eyes has...
No, not everyone who has yellow eyes. That's why I'm saying
yes.
We get suspicious by the clinical signs and symptoms.
Yes.
Yes, not everyone who has bone pains has sickle cell disease.
Thank you. Yes.
Do you understand? Yes, but those are some of the common triggers that tell us that this is, and not everyone who's losing blood has sickle cell disease, but that is one of the commonest causes. Okay. So after having seen some of the common clinical signs, we call them the clinical features. So we go ahead and do tests. So we do a test. We can do a simple sickling test done in the lab, but that sometimes may not tell us whether they look into the microscope, cannot tell us whether you're a carrier with a sickler. So we usually do it. They run a test with a machine called HB electrophoresis, and that actually tells us the percentage of the sickle cell one has and the percentage of the normal cells one has in the body. Yes. And then routinely, this is routinely done in the developed world, but here in Uganda we recently also started it. We do what we call neonatal screening, where blood sample is done for babies that are born, and we screen and see. Because it was started, they were trying to find out what is the proportion of Ugandans that have sickle cell. So they looked at the babies that are being born, and we try to promote it as babies are being born to screen them and see how. So there is what we call neonatal screening from right way, where we can see, we look at your DNA, to see if you have the trait of sickle cell.
Wow. Yes. Thank you so much, Dr. Helen. We are still here on Bethan TV for Health and Wellness, which airs every Saturday from 8 p.m. to 9 p.m. As we continue, one would want to know, is there, now that because we've been talking about, and we are talking about children and mothers, but I believe there are people who have grown a bit older and maybe they discover later that they have sickle cells, or with time. Is there a particular age where people should know they are either sickler or carriers?
Okay, so usually the signs and symptoms of sickle cell tend to manifest after the first 6 months of life. You know, when someone is in the womb, they usually they have what you call the fetal hemoglobin. Okay. So that fetal hemoglobin acquired from their mother requires very little oxygen, so it is used to stress. You understand? And that hemoglobin, for you start manufacturing the normal blood, or the normal red blood cells after birth. You start manufacturing. So as the normal red blood cells build up, this fetal or the in-womb red blood cells, in simple language, begin reducing in number. So we usually expect the in-womb red blood cells to be worn out by 6 months of age. So for some people, actually the threshold or the levels really go down by 3 months of age. But real wearing out is by 6 months of age. So depending on the rate at which your in-womb red blood cells are worn out, is when we expect the sickle cell signs and symptoms to manifest. So for some people are lucky, they have plenty of in-womb red blood cells, so their signs and symptoms of sickle cell anemia will manifest later. You understand? And also it also depends on the level of stress you faced in life.
Stress also matters in this.
Yes, you can have that gene, but as long as you do not face stress factors that trigger an attack, that trigger the red blood cells to deform in shape, you may not manifest with signs and symptoms of sickle cell. Though most of the factors that trigger are a little bit unavoidable, they are the things that we live with in our day-to-day life.
Okay.
Yes. So most children tend to manifest after they are 6 months of age. But however, we've seen even people manifesting later on in life. About those that are living with a trait, I mean the carriers, you may not know until you go ahead and do a test.
Wow.
Or actually, most families are triggered by finding out a member who is a sickle and they're like, wait.
It's a wake-up call.
It's a wake-up call. And these days we are lucky that churches are encouraging couples to test before they get married. So people are getting to find out that they are carriers when in time.
Wow. I've heard these stories. I don't know whether they are true, but I believe you're a scientist, a doctor, you know, that most people maybe that are sickler or carriers, especially the ladies, don't bear children. How true is that? Their percentage is, I don't know.
They can bear children, actually. I even had, I have a client, a good friend of mine. Wow. She had her baby, yes, sometime last year. They can bear children. Their reproductive organs are functional very well. Are functioning very well. Only that because of the anemia, they tend to stress. One, pregnancy is a very stressful situation, so they tend to have more crises. Crises, we mean the attacks that they get. So they tend to get more red blood cell destruction, more pain episodes, as compared to the usual, because pregnancy alone is stressful. Remember, you're feeding yourself with blood and you're feeding this unborn baby. You're the one feeding oxygen,
you're the one supplying,
So you're supporting more than one individual, so it is more stressful. So they tend to get more attacks than they had before. And that is one. And then two, anemia. They tend to get anemia because of anemia. So sometimes it's hard for them to carry their pregnancies to term. But if they are well managed, if a mother is well prepared before conception to make sure that her blood levels are enough, she can carry actually her pregnancy to term. So it is sickle cell is not a contraindication to carrying a pregnancy. So their reproductive organs are functional.
Wow.
Yes.
I believe I have someone who has had that message. So tomorrow you can run to Bethany Hospital and be checked. And trust me, tell your husband or friends like, hey guys, meanwhile, you think I'm a sickler? I can bear a child. Yes. Let's go for a commercial break. We'll be back with more questions and answers on health and wellness. Yeah. If you weren't, he would have come and told us. So when I saw him go there, I was like, so I want to talk about also the lifespan. The lifespan of people. But at the end, I have a sister. Where did you have a sister? You have a
Bethany TV for health.
I know her. She's
Doreen. Dora.
Even recently there's a question.
Bethany TV for health. Are you ready for this good news? You can now watch Bethany TV on your TV, Afromobile, and Airtel TV apps. Yes, catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV for health.
He challenges everyone.
The Higher Life. The Era of the World Revolution with Apostle Dr. David Kunowa and Pastor Rita Bella Kunowa of Rivers of Life Assembly International, Boston, Massachusetts, USA. Streaming every Tuesday from 8 p.m. to 9 p.m. East African Standard Time with the incorruptible, incomparable, and revolutionizing life-transforming Word of God. Only on Bethany TV for health.
health and well-being, the foundation for a bright and promising future. Join us for exciting episodes aimed at optimizing our children's physical, mental, and emotional health with our team of experts, including pediatricians, nutritionists, and child psychologists, every Wednesday at 8 p.m. on Bethany TV.
Bethany TV, for health. Every day at lunchtime, we bring you back-to-back inspirational music videos. You request your favorite gospel music video, and we play it on the playlist. To request, go to our socials, Facebook, Bethany TV UG, and Twitter at Bethany TV. Like and follow, then type the name of the song in the comment section. Get ready to celebrate all things manly. The Chord. The ultimate destination for men to explore, discover, and conquer. Interests, passions, and pursuits. Ready to level up your game? It's time to drop the stereotypes and demystify what it truly means to be a man. Excitement, inspiration, and brotherhood we share. Take charge, live life to the fullest, and become the man you've always wanted to be. The Chord, where men thrive. Every Monday, 8 p.m, live at Bethany TV with your hosts, Keith, Patrick, and Livingstone. Bethany TV, for health.
Welcome back from that commercial break. It is Health and Wellness on Bethany TV, and in the studio I do have Dr. Helen, who's a pediatrician at Bethany Women's Hospital here in Luzira. She's the best pediatrician I know. She's a lady full of smile, full of life. I mean, Bethany has every that. You don't come to Bethany and find in one piece, starting from TV to the hospital. Well, today we're talking about sickle cell disease. Before we went for a commercial break, we're talking about the reproductive part. Do these women bear children? But we're talking about women. Do men also have, do they also face challenges, in bearing children, Dr. Helen? Men usually avoid these talks, eh? Yes. It's always us who carry the burden.
Everyone can suffer infertility, whether male or female.
Thank you.
Only that society takes it that infertility is for female.
Female, yes.
But anyone can suffer infertility. But however, sickle cell as a cause of infertility, I wouldn't pin sickle cell to infertility.
Thank you.
Yes.
So now that you have not pinned any man, I think they're clapping. That is a way of telling them you've survived today. What are those risk factors that these people go through?
Yes, so someone can have the gene of sickle cell and they are living happily until they have what we call a trigger or risk factors to an attack.
Okay.
So there are those factors that are known. Remember, I told you we have the shape of the of the cell. So when these cells, the red blood cells, are stressed, that's when we have them sticking together and blocking the blood vessels. That's when we have them being distracted.
Okay.
And when they are distracted, that means we are not getting, we are getting the blood levels reducing, and then this too much jaundice coming in. So sometimes the temperature changes. If it is very cold or if it is very hot, you know that normal room temperature is 25%. So if it is if it goes like below 23% or way above like 28%, so during very hot seasons and very cold seasons, they are not friendly to our sicklers.
Okay.
Temperatures, fever. So if a sickler gets an infection, maybe a normal cold or malaria, and then they get a fever, it's not friendly to them. Dehydration, if they are not drinking enough. So that's why we encourage them to always drink, to wear their sweaters, reduce covering when it is hot. And sometimes social stress.
Okay.
Like a teacher stressing a child with sickle cell at school, threatening to beat them and things like that. So that can stress them and trigger actually an attack. Yes, though it doesn't mean that you can't discipline a child with sickle cell, but how are you doing it is very, very important.
Yes.
Sometimes too much activity, too much play, too much social activity like swimming, sports can trigger an attack. I don't mean that they can't do these activities, but to a certain time level of modulation. So those are some of the triggers. Infections, like if they get a cold and things like that. Yes.
HIV and tuberculosis.
Any infection can trigger an attack of sickle cell. Yes. Oh, wow. But though HIV is a chronic infection, unless if you have another secondary, it just lowers your immunity and predisposes you to getting other infections. Yes.
Okay. Wow. So what could be the challenges?
So the challenges, so sicklers face, you see their blood vessels all over the body. So they can face challenges in any part of the body depending on where the blood vessel is blocked. So for example, they can get pain in any part of the body.
Even the eye.
You understand, on the head they can get a headache, they can get a chest pain if the blood vessels that are blocked are within the chest. They can get tummy pains if the blood vessels around the intestines are the ones that are blocked by these deformed red blood cells. But they commonly get long bone pains, the limbs, the legs, the thighs, and the hands.
Because that's why the veins, the vessels be running.
Usually the earliest sign actually of sickle cell is swelling of the hands and the feet. We call it the foot and hand syndrome in the children. That's usually our first teller. Okay. Yes, sign. Because of blocked small vessels within the hands and the feet, so they tend to swell and they're usually painful. They do. Yes, then they get a challenge of anemia because of destruction of their red blood cells. Yes. So they tend to suffer frequent blood transfusions. Sometimes they can get a stroke. And I usually tell people that the commonest cause of stroke in children is sickle cell disease until proven.
So there are children who get stroke?
Yes.
Akokapia.
Yes, they can get
Producer,
a stroke. So for example,
I need a topic.
If the blood vessel in the brain is blocked, the child can manifest with signs and symptoms of a stroke. And actually that is a threat to their life. Yes. So a child, sometimes they can get, because of blocked blood vessels, we find an area in the body is not getting enough blood, so they can get recurrent wounds in that area. Okay. They can get hip destruction because it's not receiving enough blood because the vessels there are damaged. So they can get the head of the hip gets destroyed, so you find they tend to get pains around their hips, and then sometimes they even start limping. We have what we call priapism in the boy child. If the vessels in the penis are blocked, so you find that the child gets what we call a prolonged erection. Yes, and it's quite usually very, very painful. So sometimes they get recurrent infections because of cells. Bilirubin is like a media for bacteria to grow. Yes, it favors bacteria growing. So, and remember, they can't pull it out of their body because their liver is overwhelmed. So sicklers tend to get recurrent infections, and also the spleen. Spleen is some organ within their tummy that is very important in maintaining immunity in the body. So sicklers, this organ tends to be, for sicklers, it tends to be destroyed at a certain age in life. So after it is destroyed, they are prone to getting the common infections. Yes.
Wow, you're still watching Health and Wellness on Bethany TV, and in the studio I still have Dr. Helen, the best pediatrician we have in Uganda and at Bethany Women's Hospital. Now that we have talked about the factors, the challenges, I would want to find the medication, because that's what everyone wants to listen to. But hold up, are there different types of foods that these children or these people feed on?
I would encourage...
That dieting or what?
a parent to give their child a balanced diet, because all children need to grow. But remember, because these children living with sickle cell, or that people, by the sickle cell is not for only for children. You know, I love children so much. Or I think if the question
they come first.
To children, yes, my dear babies, you come first. Yes, people living with sickle cell need to eat healthy. They need a balanced diet. For example, if it's a child, they need protein to grow. That is the milk, fish, eggs, you know, because actually they need it more than the other children, because they are stressed. And remember, stress slows growth. So they need to feed so well for them to grow very, very well. They need their vitamins to manufacture as much blood as possible. So they need a plenty of veggies. And we usually say that the plenty of color you have, the more color you have on your plate, the better.
Okay.
Yes. So they need their plates multicolored. You know?
Paris nowadays have chips, chicken, tomato sauce.
There's no any green. Natural color. I made a natural color. I don't need the red from tomato sauce. I made a natural color.
Yes.
So if you can get them as much fruits as possible and as much different vegetables as possible, this would stimulate them to manufacture more blood in their body, because they need blood more than anybody else, because they are destroying plenty of it. Water. Sicklers need to take more water as compared to the rest of the population to avoid dehydration, because dehydration is one of the signs reasons that's why they would go into an attack. Yes. And then of course they need energy to move. You think it's easy to destroy your cells at that rate, so you need as much energy as possible. So they need the carbohydrates. So in other words, they need a balanced diet.
Basically, they need food.
They need food.
Hey, let's not go scientifically. Let's not go.
They need all food.
Thank you.
Yes.
Now that we have talked about the food, the balanced diet, medication. So
the medication, so there are some medication that we know that sicklers take for almost their life. So we have drugs they take to maintain their blood levels, to try and stimulate their bone marrow. The bone marrow is an organ. It is in the middle of the bone. You know that soft part within the bone. That's where blood is manufactured within the body. So we need the bone marrow to be stimulated to manufacture as much blood as possible, because they are destroying as much as possible. So there we give them folic acid. Or daily.
The ones of pregnant mothers?
Exactly.
That one we swallow every day?
That one they have to take almost for life, as long as they are living with
sickle cell
disease. This helps to stimulate the bone marrow to manufacture as much blood as possible. Then we encourage them to immunize their children, because they are prone to infection. Immunization, because they are prone to infection. For example, they should follow all the immunizations, and then they even get extra vaccines. Yes, extra pneumococcal vaccine, because they are prone to pneumonia as compared to the rest of the population. Yes, and then we encourage, for children less than 6 years, we encourage them to take penicillin, a daily pill. Actually, they take morning and evening of penicillin, and this helps them to reduce on the rate at which they get infections. Because infections is one of the reasons as to why, remember, their spleen was destroyed, that organ I talked about in the body, and infections is one of the commonest triggers to attacks. Yes, and destruction of red blood cells. And then we encourage them to take at least a monthly pill of malaria, Fancida. Anti-malaria Fancida, to reduce at the rate at which they get, we call it malaria prophylaxis, at which they get malaria. Yes. And then these days we started hydroxyurea, and it is readily available even on the Ugandan market. It was approved by the Food and Drug Association, that is the FDA, and it is safe. What does hydroxyurea do? So remember the red blood cells we talked about that they usually have in the womb,
yes,
that are used to stress, that are less likely to manifest with signs and symptoms of sickle cell anemia. So this hydroxyurea helps the bone marrow manufacture more of that. So that means when one manufactures more of the fetal hemoglobin or the fetal red blood cells, they'll have less of the sickle red blood cells. So if your population of the fetal red blood cells is higher than the sickled red blood cells, you are less likely going to go into an attack. So we encourage them to take the hydroxyurea as well. So those are some of the common drugs
medication
they get. Some other drugs depending on case by case and how the child is doing.
Yes. Oh, that's when the doctor can deter.
And usually I give them depending on the attack the child is facing at a particular time. But otherwise, the regular drugs are daily penicillin, daily folic acid, monthly Fancida, and then the daily hydroxyurea.
I think now that's when we say medication and you leave it to the doctor, because now whatever you've said, it's like, how does it look like? Is it a tab? Is it an injection? Is it a syrup? I don't know. But I mean, at the end of the day, it's the doctor. We shall not tell you to go to the pharmacy. No, we really discourage self-medication. We have always talked about bad self-medication, that it's always important to go to the hospital to know what exactly you're suffering from. Now, I believe there are parents who are challenged. We're talking about sickle cells, but there are those parents don't know where to start from. They feel like, what am I doing? If this child is already a sickler, where can I go? What can I do? Like, they have lost hope. And we have seen stories come up like, they have thrown the kid there because they are sick, they're not given enough attention. What message do you have for them? So
sickle cell, having a child living with sickle cell, a family member living with sickle cell is not a joke to begin with. True. It is quite stressful. First of all, the hear of the news alone,
it's a shock.
It's very distressful. And of course, it's very hard to treat sickle cell to cure. The only way of surviving it is through a bone marrow transplant. First of all, it is quite expensive to do bone marrow transplant. And then two, even the survival rates post the transplant are there.
Research is still doing more.
So one can go through a transplant and it's successful, or it may even fail to get success. Or sometimes they may not even recover post the transplant.
Okay.
Do you understand?
Yes.
Yes. And so in other words, so for those, so the biggest chunk of our population may not actually afford the transplant.
Sure.
So in other words, it is very stressful having this child that is you anticipate illness anytime to the families. And actually we've seen so many families broken down by the mere news of a child having sickle cell anemia. And sometimes you find parents are counter choosing each other. You're the one who spread the disease. For dear public, please, dear viewers, for you to have a child usually with sickle cell anemia, usually both parties have a contribution
to be together
to make towards this child getting sickle cell anemia. So to stop the blame game. Yes. And then the message I have there that with good care, a child can grow with sickle cell disease. So in other words, good care goes with early diagnosis. Very often we tell parents we need to test this child, we are suspicious of sickle cell, and then they're like, tetumuline wafi, totawana. But the earlier we make the diagnosis, the better, because if we start the appropriate drugs on time, it means the chances that your child will get the crisis are minimal, because we are helping this child being supported, they are feeding well, we are reducing the stress factors, and also stimulating the bone marrow to manufacture as much blood as possible. So I tell the population that one children with sickle cell can live a good life with good care. So in others, we need to have early diagnosis and we need to follow instructions. Sometimes we tell them about the drugs they need to take, that reviews they need to come up with, and then people are reluctant, they run to the herbals.
Churches.
And yes, herbals may be a bit beneficial, but to what is the percentage of the drug that is in the herb? Because even drugs are manufactured from
through
the
herbs, yes.
But at a measured quantity. So we know the active ingredient we are giving you and how much of that. So sometimes too much or too little of something is bad. Is bad. So with a herb, we don't know how much of the drug you're giving your child.
Okay.
You understand? Sometimes you may be the one causing the attack. Yes, and then there are sickle cell clinics all over the country, actually.
That is very key.
Yes, the government has put up these clinics, the Ministry of Health, to support the children that are living with sickle cell.
Yes.
And almost every regional referral and national referral has a sickle cell clinic. And even some private facilities also have sickle cell clinics that where these children are seen on the regular, whether sick or not, to try and support them. And then there are messages all over.
Ministry of Health has done that.
Even in Uganda, we have a sickle cell day. Yes. That is the 19th of June, where we,
create more awareness.
We create more awareness.
Yes.
It's actually, initially it started as a day, and then it came to a sickle cell week.
Yes.
Where I think they need to make it like a month.
A month. Like breast cancer month.
Exactly. That should we create as much awareness, because it is here with us.
It is.
And then I would encourage families to also test before, couples to test before getting married, like the churches these days try to emphasize, because you going in knowing what you anticipate is better. I'm not saying when you find your partner in a career you should leave them,
run away.
Them.
No.
But it's good to enter into a marriage when you're well
aware,
informed what you should anticipate.
Wow.
Yes.
I think I should end that show because she has said literally everything, but no, we shall not end now. There are stories we have seen, I've read, I've heard. There is a lifespan. People be like, you want to reach 32, you want to reach 33, you want to reach 44. Is it true, doctor? Or it is God who decides?
It's true because, to some extent, but it's God who decides.
True.
Because, of course, anyone can die.
True.
Don't normal people just fall and die?
They do.
They can. So the age at which you die, I think, I don't know, I wouldn't really pin it to sickle cell anemia. But however, because they are prone to infections and the different complications of sickle cell anemia, their life can be shortened. But with good care, to avoid the frequent attacks or crises, and with proper management of the crisis, you reduce their chances of death. I know someone who died at 81 years, and yet he was living with sickle cell anemia.
We should write a book.
I know a senior lecturer.
Yes.
I think he should be in his 60s now.
Wow.
But he's living with sickle cell.
Wow.
Anemia. So actually, children, and he's a very good scientist, a very good doctor.
That's nice.
Do you understand? So children people living with sickle cell can actually grow with good care, and they can be productive, and they can be brilliant, and even be lawyers, be doctors, and whatever profession one would want to join, they can join in.
That's thoughtful. People will say medication is expensive, but at least they've said eat well. Avoid stress. Those are not expensive, are they?
No.
They are not. And I believe when someone is sick, but the love they show, this person gets better every single day.
Exactly.
I believe in love. I believe in family. I believe in, being there for one another. I think it's always better.
And also making these children understand.
Yes.
Yes, they faced this problem. Not so much can be done to take it away.
Thank you.
And the child gets to understand their issue, and then gets to understand. Usually these children tend to do well until they're adolescents. When they're adolescents, they don't want their friends to get to know that they live with a chronic illness.
Yes.
And they don't want to be seen taking the pill. So that's where usually the problems start, because they're not taking their daily pill, and they're hiding. Even when they're in pain, they try to go to class because they don't want to be noticed that they're unwell.
True.
That's where usually the problem is. So if you make your child get to understand, and then they tend to get into depression because they're beginning to notice that they are different
from the rest
of the children.
Yes.
So sometimes that's when counseling comes in, and so that your child gets to understand that, hey, one, it is not their fault that they were born with sickle cell anemia. You understand? And then two, not so much can be done to take it away. And then three, with proper care for themselves, they can live longer. Wow. So if that can sink into a child's head, then, or a parent's head, then life is good, can be prolonged.
Thank you so much, Dr. Helen. I believe this is not the doctor's role. It is everyone's role to play. Sickle cell disease is here. Doctors are doing their role. Teachers, you have to do your role to ensure that you preach about these messages and protect these children. Church leaders, this is your part as well to play. The leaders in government, continue giving us that support. World Health Organization has given us the support. Government of Uganda has done its role. Now it's each one of you to play this role. Go and test. Don't wait for it to, be out of the blue and, be out of hand to handles that, you start running to hospitals and making families get attacks. Well, it has been a very interesting show. I would like to sign out and thank you so much for being part of the show. But before we go, Dr. Helen, you would give us the last remarks.
Okay, thank you very much for hosting me, Dorothy. Now, to our viewers out there, sickle cell is here with us. And the earlier you test and find out, the better. So I would encourage couples to test before getting married, so that they go in knowing what they should anticipate of their children. I would encourage facilities to do neonatal screening, so that we get to know who has a trait, and we follow up these children in the different clinics to see those who will manifest with sickle cell anemia, signs and symptoms, so that they start, actually with a neonatal screening we can know who has a trait and who has sickle cell anemia. Yes, we can with the DNA test.
I wouldn't know.
So early diagnosis, so I would encourage health workers to do the neonatal screening at the different facilities, so that we get to know those that are affected by the sickle cell disease or trait, and proper follow-up of these children. I would encourage parents to do proper immunization, and don't hesitate to give your child the daily pills, and feed them, reduce stress, so that the children can live with minimal attacks.
Wow, thank you so much, Dr. Helen. Well, we'd like to sign out and end this show today here, but do remember tomorrow is a Sunday. I always tell you, Sunday is the only day some have, it's their only day to God, talk to the Almighty. So please tomorrow, remember to go to church. And for me and Dr. Helen, we are out. Good night.
Bethany TV for health. Are you ready for this good news? You can now watch Bethany TV on Yo TV, AfroMobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV.